and I'm a breast cancer survivor.
The most common invasive cancer in women across the world, breast cancer, is the second main cause of cancer deaths among women. The disease strikes nearly 1 in every 10 adults and is reported to have presence in developing countries in Africa, where the majority of cases are diagnosed in the late stages. Prevalent but often hard to detect, breast cancer is the primary cause of cancer deaths among women globally, and in 2010 was responsible for about 425,000 deaths. In 2012, nearly 1.7 million new cases of breast cancer were diagnosed worldwide, representing about a 12% increase in cancer cases and 25% of all cancer cases in women.
When we say breast cancer, it's cancer of the breast. And cancer is an abnormal growth in the cells. So basically, the cells are growing rapidly than normal and are dividing more than they should.
Mary, a breast cancer survivor, was diagnosed at an early stage in 2012 at the age of 54. Though a memory Mary would rather not recount, she bravely took me down the path of her traumatic journey.
I was diagnosed at the age of 54. That was 6 years ago. I normally check my breast to see if I can see something. So one day I was checking it and I saw that there's a lump somewhere. So I had to call my sister to recheck to see if what I saw is true. So after she checked it, she said yes, she could feel the lump there. So she advised me to go to the hospital because my sister is a nurse. And I didn't hesitate. So I decided to go. I went to see the doctor. The doctor also examined it and said no, there is a lump. He had to take a sample to the lab to be sure of it. So a specimen was taken from the lump and then I took it to the lab, and then when the result came, they said it's positive. So I had to go through treatment.
Unlike Mary, who detected changes in her breast after her regular self-examination, many women in Ghana are either unaware of how to go about it or are reluctant to visit the hospital for clinical breast examination. In developing countries like Ghana, it is suggested that negative socio-cultural perception of breast cancer and strong beliefs are the main reasons for the delay in seeking medical help. Increased awareness does not seem to signal a rise in behavioral change towards screening and treatment. Although women are aware of the recommendations for clinical breast examinations, a majority of them have a negative perception about breast cancer treatment, often viewing it as a long-term, painful process. In Accra, the capital city of Ghana, I approached some women and asked about their knowledge and personal history of breast cancer and if they've ever had their breast examined. Many had not undergone breast examinations, and for some, they were still considering the possibility.
You say because a town for my either a child for if you ho into will be a was a umbrana. There was a umbrana beshe. Say you were not the hellier the better no when they obey. Nimmo dear Minyanya dear Mati dear, better one more.
Many believe they had to feel or see some extreme abnormality with their breast before seeing a doctor. This, according to experts, have these women coming to the hospital with deteriorating conditions, leaving little or no room for recovery. A vast majority of women I engaged with had skewed beliefs about breast cancer management and its outcomes, the popular concern being the removal of breast regardless of the stage of the diagnosis.
she knew one time I saw me that me or some. Mantis in the for she was she meant to say we are in our course and I'm well. The mean to she meant to me, so I don't come here. Me, saw some apple because we didn't. Oh, that. I would imagine there's some apple say, we didn't know. Oh, that baby, sir, and I know there's so much when you for me, a banana woman. I can say, and I say, we are, and we don't say, they are winning.
What is also noteworthy is that a section of Ghanaian women are very much aware of the disease and its associated risk, but are often crippled by the fear of what might happen during the treatment process. This lady narrates the ordeal of her sister with breast cancer, who has resorted to traditional medicine and waiting on God for her healing.
My sister, back was to say, I didn't have any phone. I had to say Pompobisa, but it's only Banson. I'm about to say Pomponsu. And the Oba Colbon, I'm catching say cancer and the Umbana or Swiss Baba. I feel anybody that's really asked for us, so person only sister and Baba. To say,
Another believes that medical screening and treatment are unnecessary, declaring her unwavering faith in the power of God to keep her from all illness.
Mate say breast cancer no aba ne kum nipa, but to me dear me ko check here, but I know and I have the confidence that Jesus has paid everything for me and I know I will not have breast cancer. I can go and check, but I know in me I don't have it.
Although fear has been identified as a barrier to undergoing mammography, Mary, however, has a different take on this.
The first time that I had the news was when I got scared but then after that I wasn't scared anymore. I knew I have to get the strength to face it and to fight for my life. If I'm scared and I'll be weak and I can't stand, so I have to be firm. The doctor asked me whether I was scared and I said, no doctor, I'm not scared because of my children. I can't be scared. I have to live to take care of my children, so I won't be scared. I have to face it.
It comes as no surprise that the lack of education in the public sector is an underlying cause of the delay in presenting palpable breast lumps, contributing to advanced stage cancer diagnosis. Dr. Josephine Nsafo, a general surgeon at the Kolebu Teaching Hospital, addresses the popular myths and general attitude of Ghanaian women towards breast cancer screening.
We've realized that people come late because one, they don't know the signs and symptoms of breast cancer. Secondly, those who even suspect breast cancer. In fact, we have people who come to hospital early and get the diagnosis as breast cancer, but then they disappear because they want to try alternative methods, a herbal medication, other alternative and Chinese treatments, prayers and spiritual treatments. So those are the two reasons. Those who don't know and those who know but decide to dabble in other forms of treatment. I think the important thing to know is that breast cancer is curable when we catch it early. So to catch it early, that is the breast screening. So if you do your regular breast screening, every month every woman should examine their own breast. Then once a year, you let a doctor examine it for you. So hopefully with that, we should be able to catch it when it's early. If you notice anything, just come to hospital and check.
Initiatives aimed at improving the survival rate by promoting early detection and cultivating medical help-seeking behaviors have been undertaken by government, health institutions, NGOs, among others. The month of October, marked as the annual International Month of Breast Cancer Awareness campaign, sees a rise in advocacy in an effort to raise awareness and reduce the stigma of breast cancer. Sometimes called pink ribbon culture, the popular social movement drives the theme of early detection in a bid to achieve long-term survival rates.
early detection helps a lot. Once I have survived it, I know you can also survive it.